Okay, welcome to FSOMA News 17. Let me go ahead and get my screen on. We've got David Bibby here with us today, and he's our president, and he's going to share some legislative news. Let me start my PowerPoint, and we just have a few things to go through. And I'm having technical difficulty. I apologize, David. I'm having some difficulty.
Take your time. Take your time.
Okay. Let's see.
You got it.
All right. So it's the 17th news broadcast. And first thing I need to let y'all know is we've had to reschedule Suji Self-Care Microsystem was coming up this weekend, and we just didn't have enough people sign up. They really would like it to be a live class. They feel like the information is better shared live, but we just didn't have enough of either sign up to make it worth bringing one teacher down from Chicago and all the cost of setting up a hybrid. So we're going to reschedule it for March. Look for more coming. This was a workshop that I found very valuable. It has some aspects of some telehealth you could build into your practice. It has self-care. You can bill for self-care exercises for your patients. And it has a really great reflex system to learn and to teach your patients. So look for more coming. Dimensional acupuncture is a free CEU from Dr. Shang Liang, and it's coming Tuesday, October 5th. There is a registration form, and I'll make sure it's on the homepage. He's been in practice for 30 years. He studied Master Deng. He's studied Li Chuang Huang's auricular. He's done Feng scalp acupuncture, and he's got a advanced acupuncture technique he's calling Liang's triangular acupuncture, and he's going to show us that. It's a free webinar for FSOMA members. Building Better Business, October 11th, is practice startup and sales. More information on that coming soon. Michelle Gellis is teaching a 4-hour class October 16th, effective treatments for common facial conditions. That'll be through Net of Knowledge. Then we've got a live seminar in ethical and practical acupuncture billing and coding with Sam Collins. It's in conjunction with American Acupuncture Council. So we've got some great classes coming up. Save the date, August 19th through the 21st, FSOMA conference in next summer. And I just wanted to go through, we've got 4 jobs on the job board. If you haven't seen it, you can go to FSOMA.org and check them out. I also wanted to show you, you can Google acupuncture jobs in Florida. You get a few jobs here, some of which we have on ours, and you get 30 more jobs you can go to. So just a little Google job search, you can actually put in your town or your area and focus it down. You can also set it up to send you emails when you have information. New books out from Red Wing. They give 10% discount to FSOMA members. And it's Chinese Medicine, Theories of Modern Practice, a 2-volume set. The Atlantic Symposium is a practice building conference. You can use FSOMA 2021 to save. Look for information coming out on that. We've got a new look for CE Broker. And I think what I'll do is not go through it now, but it's a little confusing. And it's a little, it used to say almost there, and now it says not completed in red. But this is mine, and I'm actually 93% completed. So you have to look at it carefully. There are a couple of other things about it. You can go up here. I can't show it to you, but you go click down and you can find the old view. If you've got a lot of classes that are more than the minimum, it's hard to see now on this transcript screen, the new one. So there are a couple things I don't like about it, but it's also a little more clear about how close you are or far you are from being complete. And I'm going to let David take over with some sad news and some more news.
Yeah, we have a few things to cover, and I want to thank everybody, of course, for joining us for News Date 17, and thank Ellen for bringing together the information for us. In the sad news tonight, we're going to start with Lillian Bridges is at home under hospice care with a neuroendocrine cancer. Unfortunately, it's not diagnosed typically until it's reached stage 4. And many people are familiar with her and her work. She's the world's leading authority on face reading and diagnosis, and she's credited for bringing this whole body of ancient knowledge back into the field of Chinese medicine, introducing it to Western medicine and business. And she's been teaching in our profession for over 30 years. So with the sad news, FSOMA was sending thoughts, for her and her family at this time, and certainly hoping for the best. And we'll update if there's more information on that. But
yeah, you can find a GoFundMe page for her. It was to pay for her care, but now I believe it's going to be dedicated to helping her two sons and her family.
So maybe we'll update with that information, as well as anybody who'd like to contribute to support her family. Thank you, Ellen.
Yeah.
In the good news, the FDA has approved clinical trials at UCLA and UCSD, I guess San Diego, for Chinese herbs and mushrooms for treatment of COVID-19. And the study is available, or the presentation on the study is on YouTube, and the link is included here. And the FDA and the FTC has been very critical of people making statements about treatment of COVID-19 without evidence to support that, and or scientific peer-reviewed evidence. And this is a big step in the right direction to provide some data to support use of Chinese herbs and mushrooms to treat pandemic. We'll follow up with more news on this too. More good news here is that a bill has been introduced in the Congress to amend the deductions allowed under health savings accounts. And Representative John Curtis, Republican out of Utah, and Josh Gothenheimer, Democrat, New Jersey, introduced bipartisan legislation last Friday that would allow consumers to use funds from their health savings accounts, flexible spending arrangements, in their health reimbursement arrangements, commonly known as, you guys know, HSAs, FSAs, and HRAs, for them to include costs related to dietary supplements and expenses related for supplements previously had only been qualifying under limited and very specific circumstances. So they want to expand that, and based on definitions for traditional Chinese formulas and herbs, they are regulated as dietary supplements. So it may be helpful for patients and practitioners to certainly be aware as this legislation moves forward. It's not been adopted and signed into law, but this would allow for them to save their receipts and put forward those onto their taxes for tax deductions. And it allows, and this is a quote here from the sponsors, putting consumers in charge of their health choices and allowing them to make informed decisions about healthcare. And as this legislation would do, it makes good policy sense, and it would permit dietary supplements to be eligible expenditures under these health savings programs, and it would incentivize healthier behaviors. So all in all, this is good news, and we'll keep following this information as it progresses through the Congress. And at some point, we've been in reaching out to the legislative sponsors to ask if they want any support in Florida for having the membership reach out to solicit and talk to our Florida congressional representatives to see if they'd be interested in co-sponsoring this legislation. We'll see how much traction it gets and how much traction it needs going forward. We've discussed this before, but Medicare for Seniors bill has been reintroduced with a few changes to it. This is House Bill 4803, and with language to amend the Social Security Act and provide coverage for acupuncture services under the Medicare program. I think the other thing that's included here is that licensed acupuncturists would be qualified providers for that care.
Yeah.
And Judy Chu has been a pretty staunch regular supporter of the acupuncture profession, and they've been refining the language in this bill for 6 or 7 years now, trying to work with colleagues of theirs in the Congress to make these changes. And hopefully with the CMS 2020 rule that included acupuncture for chronic low back pain, there's an obvious problem here where acupuncture is available under Medicare Advantage, but not available to people under their original Medicare plan. So the remedy is found in this bill. It's to amend the Social Security Act, include acupuncturists as qualified providers, and include those services under Medicare. ASA, we'll just have a quick announcement. We want to share with you that the NCCAOM ASA Town Hall meeting is scheduled for Thursday, September 30th. You could look for local time is 8 p.m. here in the East, and there is one PDA available under AOM Biomedicine. And the topic is Medicare update. This is the next steps for what I was just discussing, House Bill 4803, acupuncture for seniors. So they probably are working with their lobbyists and legislative team, and there may be some new directive from Washington that gives guidance to the profession about what help might be needed. Could be letter writing, could be calls, could be financial support. You know, we'll go ahead and provide details, but I invite everybody to join in on the town hall meeting. Just register to attend.
Yep, you should have an email. If not, contact me and I'll get you the link.
Yep.
director@fsoma.org.
Thank you, Ellen. Legislative Committee, we're still looking at the 2022 agenda, and we have our strategic planning meeting scheduled for November. The board will be together and we can take a look at what options make the most sense for the coming year. And, you know, just as a matter of information, you know, sometimes we can affect policies that affect the acupuncture profession by introducing legislation, you know, actually changing or creating Florida law. Other times we do it through regulatory decision making. And so we kind of lump those two together, where we can create opportunities for acupuncture and access for Floridians to acupuncture without actually creating new statutory language. We do it by brokering relationships either with other professions or with regulators to include acupuncture services as part of routine care. And I think that discussion is probably ripe right now with regard to Medicaid expansion. The Florida is ready to take Medicaid expansion money, and there's an appetite among some legislators to include acupuncture benefits under the state Medicaid plan. It's available through the managed care programs. If people are familiar with Stay Well and Well Care and a handful of these state-run Medicaid programs, but it's not available to, you know, millions of others of Floridians that are not under a statewide managed plan, but under the original Medicaid plan. So we're looking forward to expanding those opportunities for access to care. The link is included here for legislative campaigns, and as the agenda is decided upon, you can check there to click on it for any new updated language. And then lastly, the Workmen's Compensation Conference is Well, we attend it annually, and this looks like it has last year's dates in it.
No,
But
no, it's moved to December.
oh, I apologize. That's
Yeah.
that's right. So usually it's in August, right around the same time as our conference, but they probably, for planning reasons, moved it to December. So we'll be attending the workers' comp conference as we do year after year, because it's a great, acupuncture is included under workers' comp, and it's an opportunity for us to meet with case managers and physicians at the conference to answer questions and remind them that acupuncture is a safe and effective alternative in trying to help people get back to work.
We will be asking for volunteers from the Orlando area to come and give treatments. We give treatments at the conference. So look for a link coming soon to get volunteers. It's 2-hour shifts, or you can volunteer for the whole day. The conference actually runs, I believe, the 12th to the 15th, but we're there on the 13th and 14th in the exhibit hall, giving treatments and talking to attendees. They're lawyers, they're nurses, they're case managers. It's all sorts of people about it. So,
and it's a great opportunity. They're very open and kind of wide-eyed to the whole idea of how acupuncture is used in this way. And it's the way that the booth is set up. We usually have anywhere from 6 to 8 people sat down at a time, managing them with distal treatments, and using the opportunity to answer questions and just chat with them a little bit about what the experience is for worker comp patients that need and receive that kind of care. So it's a very hands-on, face-to-face opportunity for us to have our a full opportunity to share the benefits of what we do, our training, our background, and it's a very personal way to communicate how effective acupuncture can be, and also demonstrate our own professionalism and our enthusiasm for our medicine. In the years that I've done that, it's always very rewarding. So I'd encourage anybody that's in the Orlando area or willing to travel, just for half a day, to come do that. It's really great.
Yeah. All right.
AccuEd Day is on the calendar. I think it's February 8th. Yeah, for 2022.
Yeah.
And same thing, we were just discussing, it's another opportunity here. We're going to be live at the Rotunda in the Capitol at Tallahassee, and we meet with legislative aides, legislators from time to time themselves, other people that are, having business in the Rotunda. And it's an opportunity to interact, share information, and if there's a legislative agenda that we want to speak to. But other times it's just being friendly, being helpful, answering questions, and bridging the disconnect between acupuncture and the rest of the healthcare delivery model. And the more opportunities we have to do that, the better the outcomes are for the profession and the medicine.
Yeah, it's a great event.
Yeah, always.
So much energy up there. It's pretty amazing. And the people that come to get treatments in the Rotunda, we really take the stress down. They really can tell the difference.
Right. No, they're in high gear all the time up there, and just, taking 15 or 20 minutes to, lay back in a recliner and enjoy an acupuncture treatment. It can change their day, change their week. And maybe, it's an opportunity as well for us to refer them to see somebody in their own area, give them an opportunity to ask questions, or maybe the first time they're meeting an acupuncturist face to face. It's important to be able to humanize our medicine and, humanize the practice.
Yeah.
Thank you, Ellen.
Thank you. Let's see if we have a few people there. Let's see if there's any questions. If you want to put a question in the chat, and if you have any questions about anything we've gone over. We've got Miami represented, or Southeast Florida. Any questions from anybody in the audience? We don't want this to be necessarily one way. You can always call the office and we can find the answer if we don't know it. We're here to support you. And that's the news for this month.
Right.
So, all right. Thank you all for being here. Thank you, David.
Very
And
welcome. Thank you, Ellen. I appreciate the
right.
presentation. Thanks for the effort.
talk
Thank
to
you,
later.
everybody in attendance. And, Ellen and I get, questions all the time, on a daily basis. So if there's something that you want to discuss or have a question about, don't hesitate to contact the office. Thank you.
All right. Thanks. Bye-bye.
Thank you, Ellen.